Good morning. My name is Bellal Joseph. I'm the Martin Gluck Professor of Surgery here at the University of Arizona and the Chief of Trauma. First and foremost, I'd like to thank my co-authors for their work in this project as well. Time to resuscitation and hemorrhage control is critical. We know that this is what has evolved in the last few years. Many studies have focused on the time to hemorrhage control. However, time to resuscitation still remains largely unexplored. There also has been a resurgence of whole blood use in resuscitation in civilian trauma centers, and this continues to grow. The effect of timing of whole blood transfusion on outcomes really remains unclear. We set out to do a 3-year ACS TQIP study. We looked at all adult trauma patients who received at least 1 unit of whole blood within 2 hours of emergency department arrival. Patients were then stratified into 3 groups. Those who received their first transfusion of whole blood within the first 30 minutes, those who received it within the second 30 minutes, and then those who received it within the second hour. We used the first 30 minutes as our reference group to evaluate outcomes. You can see here this table that looks at outcomes based on timing of transfusion of whole blood. And initially, you see that the mortality actually doubles in patients who do not get their whole blood in the first 30 minutes, but rather in the second 30 minutes. And this continues to worsen the first 24-hour and in hospital mortality in those who receive delayed whole blood transfusion into the second hour. We also see that acute kidney injury also worsens both in the second 30-minute group as well as the second hour group. We then stratified our patients and looked at mortality of bleeding patients with a shock index greater than 1. And you can see here with every 30-minute delay of whole blood transfusion, the overall adjusted odds ratio for 24-hour and in-hospital mortality worsened. And every minute delay in whole blood transfusion is associated with a 2% increase in odds of 24-hour and in-hospital mortality. Whole blood really should be readily available and easily accessible in the trauma bay, as earlier resuscitation for hemorrhaging trauma patients improves overall outcome. The decrease in mortality associated with earlier whole blood transfusion was more pronounced among patients who had a higher shock severity. Thank you very much.